Welcome to Back on the Bus. I'm Sharon Rieger and I work as a physical therapist for schools and back clinics. Through this work, I've found that bus drivers are quite vulnerable to back problems. Sometimes I get a little frustrated because I know the many problems I see can be prevented with a little training. Our goal in this tape is to share information about back problems and injuries. We'll also talk about prevention. Why is it that bus drivers often have back problems? Low back pain is a common problem among professional drivers. In fact, studies show that truck drivers have one of the highest rates of back injuries. Long periods of sitting, along with driving and vibration, place a lot of stress and pressure on the spine, which lead to disc and other serious back injuries. Incorrect sitting and standing postures cause many of the aches and pains. Poor sitting postures either push a spine into excessive inward curve, a condition called lordosis, or an excessive non-curve, a condition called flat back. Combine poor posture with all the vibrations, twisting, and excessive sitting. Ouch! Just thinking about it gives me a backache. Your body's characteristics can leave you more prone to certain types of back injuries. In the clinic, when I talk with patients, I generally need to know three things. First, how muscular are you? If you are weak in the upper or lower extremities, abdominal area, or in the back itself, this can obviously cause problems. As a driver, you need strength in all these areas. Second, how flexible are you? Flexibility refers to how well and how long your muscles are able to conform to a stretch. When the muscles in your legs, hips, pelvis, and spine are tight, they are much more vulnerable to injury. Third, how is your cardiovascular system? Your heart is like a car's engine, pushing blood and nutrients around your body. If your heart isn't strong, just like your car, it doesn't give you the energy you need. And when you are tired and you don't have that energy, that's when you are more likely to get injured. Once I learn where my patients are vulnerable, I can then recommend an effective prevention and awareness program. There's nothing really glamorous about prevention, except that it's truly the best way to save your back. For bus drivers, posture is an easy and very effective prevention measure. The way you position yourself at the wheel can determine your risk for back injuries or chronic back problems. Proper driving posture looks like this. You have a balanced pelvic tilt controlled by stomach and back muscles. Your shoulders are directly over your hips and your eye gaze is directly horizontal. It is often helpful for drivers to use lumbar rolls, towel rolls, or other devices to help change their sitting posture. Many jobs that require physical activity are better performed after warm-up exercises. It is also important to stretch and condition those muscles that will be used most while driving. We already talked about posture, but it's worth thinking about as an exercise. Try to practice the following. Tuck your chin, shoulders back, tighten your stomach. Now hold it. Again, tuck your chin, shoulders back, tighten your stomach. Now hold it. I encourage clients to train their minds and bodies to become more comfortable with this posture by repeating this exercise 25 times a day. Pretty soon you'll find that you are assuming this position without even thinking about it. For drivers, I recommend building strength in the arms, legs, back, and stomach area. You can easily strengthen these muscles even without exercise equipment. I recommend doing push-ups. It's also smart to use hand weights to help build upper body strength. And finally, shoulder raises are good for building strength in the neck and upper back. Now let's talk about leg strength. One of my favorite exercises is wall squats, mainly because it's always easy to find a wall. Here's what you do. Stand about 2 inches from the wall. Check your posture. Remember, chin, shoulder, tummy. Now lower your body toward the floor. Hold that for 5 to 10 seconds. Now straighten back up to the standing position. Wall squats are an excellent way to strengthen your upper thighs and work on your posture as well. You've built up your arms and legs. What's left? Trunk strength refers to the stomach and back muscles, and for drivers, these are critical. These are the muscles that tend to weaken with age. Here are a couple simple exercises you can perform. The first one is called abdominal crunches. This exercise builds your stomach muscles. Lie on your back, knees up, and hands behind your head. Then work your head and arms toward your knees. Hold for 5 seconds and back down. The second one is called elbow push-ups. This exercise helps build your back muscles. Lie on your stomach with your elbows up on the floor. Raise your head and chest up by arching your back. Hold for 5 seconds, then back down. No matter what profession you are in, cardiovascular exercise is essential. A simple walking, biking, or swimming program is usually sufficient. But everyone is different, especially when it comes to heart conditions. I recommend that you consult with a doctor, physical therapist, or exercise specialist on how you can achieve excellent cardiovascular fitness. Just remember, fitness starts with the heart. Believe it or not, you can change how flexible your body is. The flexibility of certain muscles affect back pain. These muscles are the hamstrings, hip flexors, piriformis, and the spinal muscles. You've heard about athletes pulling a hamstring. They are located right here on the back of your thigh. They can make a difference in your pelvis location on the spine because they are connected to the pelvis bone. Simple stretching, either while standing or sitting, can make a difference. Try something like this. Once you start to feel the stretch, hold for 5 to 10 seconds. Remember, do not bounce. A hip flexor muscle is located on the front of the thigh, in between the stomach and the knee. This can be stretched by lying on your stomach and pull up toward your buttocks. Again, remember to hold this stretch for at least 5 seconds. Another stretch of the same muscle involves standing with your hands on your hips and leaning back. Then hold the stretch. One of the other hip muscles, which is usually tight, is called the piriformis. It is located under your bottom muscle. To stretch this muscle, lie on your back, bring your knees up, and cross one leg over the other. Then use your knee to pick up the leg. Again, lie on your back, knees up, one leg over, then pick up the leg. Finally, we'd like to give our spinal muscles a stretch. Stand or sit with your hands on the hips. Rotate your upper body, including your head as far as you can go to one side. Hold for 5 seconds. Do the other side. Now stretch toward the floor. Hold for 5 seconds and do not bounce. I recommend general stretching in all directions. For example, with your knees bent, take arms and stretch to the right. Then go to the left. Now stretch down toward your feet and then up to the sky. It's simple. Now let's repeat all the stretches. Try to develop a routine like this. First, do a standing stretch, remembering to hold it for 10 seconds. Second, lie on your stomach and pull up. Third, roll over and lie on your back with your knees up. Then cross your leg and pick up that leg with your other leg. Do that 10 to 15 times. Then switch sides. Fourth, and finally, rotate your upper body, stretching your arms to the right, then to the left, stretching up and down. Again, develop a routine and all this becomes simple. Let's wrap things up by reviewing these important points. First, Remember your posture, both on and off the bus. Before you drive, do warm-up exercises to prepare your neck, back, and shoulders. And finally, stay fit by working on your flexibility, strength, posture, and cardiovascular system. I've enjoyed sharing this time with you. Remember, you can have a healthy back. Take care now.